Hello, everyone. My name is Maria. Thank you, Paul, for that introduction. I know it just went a bit weird then. Last time, Paul, you actually introduced me. You mentioned that I had lost my taste from COVID, and it's crazy to think that I think it was 3 months back then. And it's actually crazy because it's not fully back yet after 8 months. But like I said last time, unlike my taste buds, it's wonderful to be back, and I cannot thank you, group, enough for giving me these opportunities. So I'm a medical student studying at the University of Bristol, as you mentioned. I just turned 21, actually 10 days ago. I'm also currently a young trustee for Creative Youth Network, a youth charity organisation, and I've been part of research projects with the Health Foundation for the past couple of years now. So it's been a great morning, and I can't wait to hear from the other speakers too. Everyone's been super honest and open, which is what I'm going to be doing too. But today I'm going to be doing something a little different. I've spoken at conferences before, but I'll be honest and say that this time for me it feels really different. I feel less prepared, more uneasy, and I've always found it nerve-wracking to know so many people are listening to me, but now it's even more so. Lockdown the past couple of months has really taken its toll. And overall, I'll be talking about how COVID impacted our mental health. But a lot of what I say is what I personally relate to. So it would be interesting to see how many others relate to it too. Initially, I actually really liked lockdown. I felt like it gave me the break that I needed from a busy life. And it also gave a lot of time for self reflection, which really helped me grow as a person. However, around October time, I really began to feel the negative effects. And I'll be reading a poem in a few moments, but I just wanted to read this short passage I wrote a couple months ago. It must have been 3 or 4 a.m., and I was thinking about what I wanted to say for this conference. When I read back through it more recently, I was going to discard the whole thing, thinking it just felt a bit too emotional. But I decided I'll read it, just to give an insight to just how I was feeling at the time. And I guess it just makes talking about all this a bit more real. So my chest begins to tighten as my breath gains some depth. I wonder why I'm breathing faster, even at rest. The doctors say it's anxiety and that I'm depressed, but I reject what they say, that they don't know what's best. As time goes on, I start to feel more bleak. The thought of not going out feels more like a relief. From being what was a social butterfly to being wrapped up in a cocoon, I now struggle to find the right replies and always turn my camera off during Zoom. Detaching myself from everyone, my friends and my family, they can't know how I'm feeling. What would they think of me? I went from being determined, ambitious, and motivated to slowly feeling like my goals were all faded. A lack of support in my education just further adds to the struggles that I'm facing. Insomnia for the past couple of months, I feel like I'm going insane, but other people have it worse, so who am I to complain? I just got to get through this. That's the aim. Just another day in lockdown. I hope tomorrow night is not the same. So that was genuinely something that I wrote just laying in bed one night. And the reason I wanted to put that in was because I think it's easy to overlook how someone or yourself is feeling or what your mental health status is like when in the present you come across as seemingly okay. It's also easy to overlook how these experiences can affect how people will feel in the future. And I'm just one individual out of many who feels the effects of COVID. Sometimes I'm even in denial and don't believe I even deserve to sit on this spectrum because I think of other significant mental health effects. I was actually, however, surprised after I did a little bit of research. But before we move on, I just wanted to ask you all a question. So there should be a poll now. And the question I wanted to ask all of you is whether you feel that your mental health has also been imposed during COVID. sorry, I can't see the results, so I didn't know it was already done. Okay, 82%. Okay, so that's really interesting. I wonder if we weren't sat behind screens, this wasn't an online conference, would we be able to look at the person next to us and be able to tell whether they look like they were or have been suffering with their mental health? 82%, that's 8 out of 10 people, so that would be a lot of people. Of course, everyone has been affected differently and during different times, but it is an interesting concept to think of, whether you'd be able to recognize that. Research by the Health Foundation found that 2/3 of adults in the UK report feeling worried about the effect that COVID-19 is having on their life. These worries include their future, feeling stressed or anxious. So if I alone have seen how anxiety has affected my work and motivation, imagine the effects on a larger scale with 2/3 of the population. I guess my point here is also to remember that COVID-19 has been a struggle for everyone in ways you or people themselves may not understand. In the community, in the workplace, and in the services you provide, keep that in mind when talking to your peers. We follow the advice to wear masks and social distance to help ourselves and others, but post-pandemic, we also need to ensure that we are uplifting and helping those around us. I've seen people who have been left broken from lockdown and others who have enjoyed it, but I've not spoken to a single person who has not endured negative emotions from it all. And I'm going to list a few things that have contributed to this, but the list is endless and everyone has their own individual factors. And some people would have been affected in certain areas more than others, of course. So a big one was, of course, social isolation, particularly for those living alone and those shielding. It leads to the effects of loneliness, but also serious concerns of things such as domestic abuse. Number 2, job and financial losses. From the fears of losing jobs to the struggles of not being able to meet basic needs, these worries really affected people's mental health severely. In a study researching this, almost half of participants were worried about not having enough food to meet basic needs, and 1 in 5 had experienced suicidal thoughts. Number 3, volunteering losses. We all know that volunteering is great for our mental health, yet numbers have halved as people may be in risk groups or activities have been halted. Number 4, quality of housing. The area and type of house you live in would of course have made a large impact. For example, the effect of someone living in a block of flats in a deprived area with no garden, it's likely that they will be more significantly impacted than someone living in a semi-detached house that has private outdoor access. And loss of coping mechanism. For some of us during times of stress, we turn to meeting friends, family, going out, going away. And even though we use FaceTime and social media to stay connected, for many, this may not have even been possible. From these 5 factors alone, you can see how mental health would have been impacted. However, I'd just like to highlight the disproportionate effect of COVID-19 amongst ethnic minorities. We know that the Black and Asian community have been at a bigger disadvantage from the start of COVID. We saw that they had more COVID cases. The loss of many doctors and healthcare professionals were also predominantly from these backgrounds. Consequences from significant COVID-19 infection included increased rates of PTSD, anxiety, depression, and also specific neuropsychiatric symptoms. Given the higher risks of mental illnesses and complex care needed among ethnic minorities and in deprived inner cities, COVID-19 hit minorities with a much more harder impact. But not only did cases of COVID itself disproportionately affect ethnic minorities, the consequences of lockdown were also much more detrimental for them. Levels of anxiety and depression were actually falling when lockdown measures began to lift, but the rates remained the highest in young people, those with lower household income, those with diagnosed mental illnesses, people living with children, and those living in urban areas. Many of these social inequalities are evidently more prominent for those in minority groups, and the differential economic impact by ethnicity can be driven by unemployment, income loss, or financial insecurity. For example, Pakistani men are 70% more likely to be self-employed than the white British majority, and the incomes of self-employed workers are more uncertain. In addition, men from minority ethnic groups are more likely to be affected by the shutdown. Bangladeshi men are 4 times as likely as white British men to have jobs in shutdown industries, and Pakistani men are nearly 3 times as likely. An article by BMJ also highlights that racism and discrimination suffered has been a noted key factor behind the disproportionate impact of COVID-19 in the UK, although this has been downplayed. I remember at the start of lockdown during the Black Lives Matter movement, when it was being brought to light the injustices upon Black patients who were treated unfairly by many professionals in the healthcare setting. There is a lot of research done on this, and I implore you all to look into this more closely and to see how racism and even things like unconscious bias severely impact the health of minorities. Pre-pandemic, minority groups were already at a disadvantage. However, throughout lockdown, they have been subject to more adverse consequences than their white counterparts. I remember even at the start of lockdown, my own family being discriminated against, people being rude that they carry COVID more than others, ignorant to the fact that it is socioeconomic factors underpinning this rather than people themselves. When I was asked to talk at this conference, I wasn't exactly sure what I was going to say. And I feel like there was so much that could be said that I didn't know where to start, or that I wouldn't be doing myself and the people around me justice. But one thing for sure is that as things are presumably said to go back to normal, we as a society should wish that normal has changed. From experiences such as the Black Lives Matter movement to attending conferences such as these and gaining knowledge, I hope we can find ourselves in a better and more educated position for how we can uplift those around us and help people through their disadvantages. So thank you for listening to me talk. I'm now just going to be reading a poem that I wrote, summarizing some of the things that I've spoken about and more. I'd like you all to just listen carefully and think about the things I say, and I'll also be interested to know whether you listening can resonate and relate to some of the things that I say. So when you look into the mirror today, who do you see? Is it someone who's prospered since 2020, March the 16th? The era of a new time propelled by COVID-19. For some, a break from their busy lives, and for others, a door to insanity. If only we knew about all this uncertainty, would we have cherished the prior stability? The stability of constant support, whether that be in education, family, or work. For some, being furloughed was a heaven on earth, but for others, it meant things took a turn for the worse. Many lost the security of an income to pay the rent. Unfortunately, not all bills are covered with 80%. While some relationships got better, many got worse. Where others gained, some lost their supportive network. However, it feels like we do have one constant, and that's the inconclusive decisions of the government. During the time where schools, colleges, and universities were all closed, 83% of young people agreed that poor mental health was imposed. Where socioeconomic factors already played a role, the cost of COVID increasingly took its toll. As support and opportunities are further seized, the effect on minorities is even more deemed. Where free school meals provided children with what is an essential, the stress of staying healthy added to parents' tension. Months of loneliness and isolation, alongside poor mental health and deprivation. For the vulnerable who have spent the years shielding, I cannot imagine the effects of just four walls and a ceiling. It's been a year of confusing decisions, where freedom began feeling like a distant vision. They say we will go back to normal, it's just a matter of time, but they don't tell us that time can as quickly free my mind. Free it from the chains that came with COVID-19, the ones that are disregarded because they cannot be seen, the chains that wrap around our mind and make you question yourself, the chains that are described as poor mental health. The consequences that are depression and anxiety can all be helped if we work as a society. We're in a year of change and innovation, and we've been trying to make the best out of a static nation. All we need is consistent perseverance for us to see that we can make the biggest difference. Just by understanding that we have lost, gained, and learned, that we've been healing and we've been hurt. Whether you're in your 60s, 30s, or your teens, the detrimental effect is clearly to be seen. Many of us are lucky and can make the right decisions to not forget about those who have been in worse positions. So when you look in the mirror today, who do you want to be? Is it someone who understands and helps others starting June the 17th? Thank you so much for listening.
Thank you, Mariah. As ever, that was, I think one of the words used in the chat was absorbing, and it was.